Hi everyone, my name is Ali Stewart and I'm a midwife with NHS Tayside and I'm based in Angus Birth Unit. So today I'm going to take some time out of my busy schedule of decorating and feeding children lots of snacks to tell you a bit about membrane sweeps. So I'm first going to tell you a bit about the cervix and what that does. So the cervix is a neck of tissue that sits at the bottom of the uterus. So there's the lower segment of the uterus and right at the bottom of it sits the cervix. Now the cervix has a very important job during pregnancy, and that is to remain closed and protect your baby from infection. So throughout pregnancy your cervix is quite long, quite firm, and it is closed. Towards the end of pregnancy it starts to change and start to prepare itself for labour. It does this by thinning out, so midwives call this effacing, and it can also open up a little bit and soften. Sometimes the cervix can come from quite a posterior position to come forward a little bit as well, and this is all perfectly normal changes towards the end of pregnancy. So when is a sweep performed? At your 40-week appointment, your midwife will have a chat about a membrane sweep and potentially discussing induction of labour a bit later on as well. A membrane sweep can be offered if the pregnancy goes on beyond 41 weeks gestation. Now, sometimes doctors will recommend a sweep is done earlier at around about 39 weeks, maybe even 38. And that is always due to reasons such as complications within the current pregnancy or events of previous pregnancies. So please don't be too concerned if the lady down the street has had a membrane sweep a bit earlier but your midwife has offered you one at 41 weeks. For a post-date sweep, the midwife does prefer to wait until after 41 weeks gestation to do this, and the reason is that by waiting until this stage of pregnancy, it's much more likely to be successful. The main reason for a sweep at this stage would be to avoid induction of labour, and this would be normally planned between 41 weeks and 5 days gestation and 42 weeks. Sweep is a vaginal examination performed by the midwife, or in some cases by the doctor. The midwife will use her finger to get between the membranes and the cervix. By doing this, it releases the body's own natural hormones, prostaglandins, and they make smooth muscle contract and therefore can bring about labour. Sometimes the sweep itself can be a bit uncomfortable, and if you do have a sweep and feel that it's too sore, then you just ask the midwife to stop and we will stop the procedure there and then. Following the sweep, it's quite common to have either some crampy pains or to be losing some show, and show is the sometimes blood-tinged mucus that comes away when the cervix starts to dilate, starts to open up and get ready for labour. It's very important that you contact the midwife if you have any concerns at all. So if you have any worries about baby's movements, if you feel that baby's movements have perhaps reduced or a little bit different, if you have any bleeding, bright red fresh bleeding, or you have regular contractions, or if your waters break as well, please contact the midwife at maternity triage on 01382 632 075. If the membrane sweep doesn't work, then you can come back in another 2 or 3 days to have another sweep if you wish. Please remember, with all procedures and tests, the choice to have these is yours. It is the role of the midwife and the doctor to inform and support and advise, but ultimately the decision is always yours. So thank you very much for listening and stay safe.